Thank you, Mr. President. Mr. President, on another matter, recently Leader McConnell and Dr. John Barrasso, the distinguished senator from Wyoming, and I engaged in a colloquy regarding President Obama's nominee for the head of CMS, that's the Centers for Medicare Services, Dr. Donald Berwick. Simply put, Dr. Berwick has a long history of very interesting statements, pertinent statements that support government rationing of health care, an issue that I have fought against vigorously throughout the entire health care debate. The White House response to our colloquy, it seems to me to be most unfortunate, if not rather incredible. Here is what the Obama administration had to say, quote, "No one is surprised that Republicans plan to use this confirmation process to trot out the same arguments and scare tactics they hoped would block health insurance reform. The fact is, rationing," and I continue the quote from the White House, "is rampant in the system today as insurers make arbitrary decisions about who can get the care that they need. And Dr. Don Berwick wants to see a system in which those decisions are transparent and that the people who make them are held accountable." End of quote. This is really a fascinating response, it seems to me. Instead of flat-out denials of government rationing, we have excuses. And if you read between the lines, you will notice that for the first time ever in this debate, the Obama White House is admitting that their health care plan will ration health care. Just going to make it transparent. Remember when Republicans like myself and Senator John Kyle and Dr. Coburn, the senator from Oklahoma, tried to warn that health care reform would result in government ration care? We were dismissed as crazy reactionaries, or even worse. President Obama accused us of trying to scare people, and no less than the American Association of Retired Persons, ARP, that organization that purports to represent Medicare patients and seniors all across our great nation. They said that our rationing concerns were a mere myth, that none of the health care reforms would stand between individuals and their doctors or prevent any American from choosing the best possible care. How interesting that now, after the health care bill has become law, that the President is admitting that we were right all along. Now, listen again carefully. Here's the quote: "Don Berwick wants to see a system in which those rationing decisions are transparent and that the people who make them are held accountable." This is a complete about-face. Although cloaked in the typical straw man arguments that have come to characterize this administration, the statement is undeniable. The government is going to ration your health care. To set the record straight, I do not accept rationing, whether it be transparent or otherwise, and I am opposed to rationing, whether it is done by the government or by an insurance company. I'm not defending any of the practices of insurance companies who have unjustly denied claims. And I am against rationing, whether it is proposed by Republicans or Democrats or think tanks or the special interest sidelines here in this city. But the Obama administration's response does nothing to address my concerns that our government will ration health care. Instead, we finally have an admission from the White House that this is what they plan to do. Now, I'm not holding my breath for an apology or any correction from the President or AARP or any of the other organizations who demonize our concerns for the past year. But I do intend to ask some very tough questions of Dr. Berwick, the President's pick to implement and enforce literally thousands of regulations that will soon come pouring out of the Department of Health and Human Services and that will inevitably include rationing. And it's nothing personal. As I've said before, I've met Dr. Berwick. He's a very personable, affable, intelligent man. I don't doubt that he has some support from his peers who know him. I'm not questioning his honor or his motives or his love for this country. And as an aside, I would appreciate it, and I know a lot of other members in this body would as well, if the White House extended the same courtesy to me, and for that matter, anybody else raising questions, serious policy questions. But we have a fundamental disagreement about the future of our health care delivery system. And I happen to think that it's important that we have this conversation so the American people can understand what's really going on here. So please quit attacking my motives and the motives of others. Accentuate the policy, eliminate the politics, and don't mess with those in between raising reasonable questions. That's an old song. It rather dates me, but I think it's appropriate. Questions like this. What did Dr. Berwick mean when he said, "I am a romantic about the British National Health Care Service. I love it. All I need to do is rediscover the romance, is to look at the health care in my own country." So he's pretty romantic, or both romantic and supportive of the British National Health Care Service. Now, with cancer survival rates for women 10 percentage points higher in the U.S., the survival rates, than in England, and over 20 points higher for men, why does he think that their government-run system is superior to our system? And please explain this quote. "If I could wave a magic wand, health care would be a common good single payer. Health care would be a human right. Universality is a non-negotiable starting place. Justice would be a prerequisite to health equity as a primary goal." Now, that may sound very nice, very idealistic. The reality is that declaring health care to be a human right necessarily places some citizens' rights above others, suppressing the rights of some in favor of another government-favored group. Because if you're saying that health care is a universal right, what you are essentially saying is that some people have a right to somebody else's property, whether that be taxable income or doctor services or their health care. And I disagree with this argument. Health care has become an entitlement for some in this country, but it cannot be properly described as a right without egregious government coercion and income redistribution and patient care consequences. But maybe that's okay with Dr. Berwick. After all, he did say that, quote, "any health care funding plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poorer and less fortunate," end of quote. I want to hear more from Dr. Berwick on this point. Furthermore, what did he mean when he said that equity is a necessary component of quality? Does that mean that high-quality care should not be available unless it is available to all? This certainly seems to square with the United Kingdom's practice of denying or delaying access to the latest breakthrough drugs and technologies because of their high costs. What does Dr. Berwick think this attitude will do to investments and innovation in new life-saving treatments? And what about this quote? "Limited resources require decisions about who will have access to care and the extent of their coverage. The complexity and cost of health care delivery systems," as I continue the quote, "may set up a tension between what is good for the society as a whole and what is best for an individual patient. Hence, those working in healthcare delivery may be faced with situations in which it seems that the best course is to manipulate the flawed system for the benefit of a specific patient, rather than to work to improve the delivery of care of all." Now, is this a suggestion that it is a doctor's duty to concentrate on the good of society over the good of his or her patient? That certainly sounds like a proponent of socialized medicine to me. And I don't use that word, or I use that word very carefully. And finally, this is a question about the following statement by Dr. Berwick. Most people who have serious pain do not need advanced methods. They just need the morphine and counseling that have been around for centuries. That's an amazing statement. I know Dr. Berwick is familiar with the, quote, "Liverpool care pathway to death" that is employed in the British healthcare system, and its reliance on morphine and counseling. He should also be aware of the growing concerns of many British doctors that this so-called pathway to death is being overused for patients who could have otherwise recovered, especially stroke patients. Is this what is being advocated to the American healthcare system for Medicare patients? This certainly sounds like the, quote, death panels that became so roundly ridiculed and dismissed by Obamacare supporters during the last year's debate. Now, I know that socialized medicine and death panels have become loaded terms. I understand that. But if that is what you are for, you should just say so. Don't be afraid to have this discussion. Dr. Berwick certainly hasn't been shy about his views in the past. And maybe this is a comment more appropriately directed at the administration than at Dr. Berwick. But don't hide behind straw man and name-calling of those who disagree with you. I have legitimate concerns, many of us have legitimate concerns about the direction we are taking in this country with particular regard to health care. The thousands of people in Kansas who have contacted me over the last year have very legitimate concerns too. And if you don't think that I deserve some answers, they certainly do. The American people are sick and tired of being told that they are crazy or racist or that they don't know what they're talking about or are being misled or that any question raised is simply partisan politics. Promise after promise has been broken, Mr. President, from the pledge not to raise taxes to the promise that if you like what you have, you can keep it, to the falsehood that this new law doesn't cut Medicare. And remember the one about lowering premiums. And the list goes on and on. And it is now beyond a shadow of a doubt that the law will ration health care. I think we are duty-bound to hold this administration and its nominees accountable for these broken promises and for what lies ahead for patient care. That is why I will continue to ask the hard questions that need to be asked of this nominee. I will continue to fight against what I truly believe is government rationing of health care. I did so on the Health Committee when we considered it, the Finance Committee when we considered it, and during the reconciliation process when we consider it. All, of course, were defeated by party line votes. And I will continue to maintain that the American health care system, with all of its flaws, is the best health care system in the world. We need to fix the flaws. We don't need rationing. And in the case of Dr. Berwick, we need answers. I yield back the balance of my time.